Good afternoon, everybody. Welcome to this in our NIO series of Lunch and Learn seminars. I'm really excited to see so many people here. I think we've got 68 attendees now, and it's been growing in the last few minutes. So I think probably just in the interest of trying to keep to time, because we've got a packed agenda, and I know people may have some specific questions, we might just kick off. So thank you so much for everybody joining us. My name is Dr. Lucy Jessop. I'm the consultant lead in public health medicine for the National Immunisation Office. So just so that you're aware, the session is being recorded and it can be available for any of your colleagues on YouTube or on Spotify channels. And you will get a certificate of attendance for people who attended the entire session. Something very important is please make sure you keep your camera off and also on mute. That just makes sure everybody has a better experience and that everybody can hear what is going on in terms of the webinar. And then we have a chat box at the bottom. You can see if you can add your questions to the chat box, if you make sure that they're to everybody. So that means everybody can read the question and then people don't need to ask the same question multiple times. We will be answering those question and answers at the end. So I have several team members here who will ably assist in answering the questions. Unfortunately, I will have to drop off before the end of the meeting, but I know the team will happily answer any of the clinical questions. And just to be clear, this is a clinical session, so the questions we can answer are clinical. We will not be able to answer any of the operational questions. You would be best putting those to your operational leads in the different areas, but the clinical questions we'll be more than happy to answer. Cría, are you able to put on the agenda so people can see what we'll be covering? So first of all, we have Treasa, Dr. Treasa Kelleher, who will be giving us a great rundown of catch-up vaccinations and how to have confidence in ensuring that you catch up people correctly to the IRIS schedule. Then Cliona, who's our chief pharmacist on the vaccine management, and then Cría from our communications department on supporting materials, and then hopefully we'll have plenty of time for question and answers at the end. So thank you very much again. I see we've got 82 people now, which is brilliant. And I'll just hand over to Treasa now to begin the seminar. Thank you.
Thanks very much, Lucy, and welcome everyone to our NIO Lunch and Learn on catch-up vaccinations with some particular emphasis on catch-up vaccination for beneficiaries of temporary protection and international protection applicants. And my name is Dr. Treasa Kelleher. I'm a specialist in public health medicine working in the National Immunisation Office. So the objectives of my talk today are to be able to, and what I want you to be able to do at the end of it, hopefully, is to be able to identify when catch-up vaccination is needed, to understand the reasons why patients may not be up to date on their recommended vaccines, and as I said, particularly focus on catch-up vaccination for beneficiaries of temporary protection and international protection applicants in Ireland. Next slide, please. So immunisation is a global health and development success story, saving millions of lives every year. It plays a crucial role in achieving, either directly or indirectly, 14 of the 17 United Nations Sustainable Development Goals, particularly Sustainable Development Goal 3, to ensure healthy lives and promote well-being for all at all ages. And vaccines provide important protection from a number of vaccine-preventable diseases. And it's important that migrants coming into Ireland are age-appropriately vaccinated to protect them against these diseases. As a general rule, infants or children more than 1 month or 1 dose behind the schedule should be on a catch-up schedule, with the intervals between doses reduced to the minimum allowable. And please see Table 2.2 in Chapter 2 of the National Immunisation Advisory Committee Immunisation Guidelines for Ireland for the optimal and minimum recommended ages and intervals between doses of the primary childhood schedule. Next slide, please. So why might individuals be behind schedule? There could be a number of reasons as to why an individual may not be up to date with their vaccinations, such as a change in parental opinion. So they may have previously declined or been hesitant about vaccines and now may be consenting to vaccination following receipt of further information. There may have been other life stressors at the time when the child's vaccines were due. They may be late entrants to the Irish health system, which includes beneficiaries of temporary protection and international protection applicants. And this may include those coming from areas of conflict, such as the Ukraine, marginalised population groups, as they may not have had access to immunisations, or those raised during periods before immunisation services were well developed. And individuals who are not up to date with the schedule are not adequately protected against vaccine preventable diseases and should be vaccinated as soon as possible. Next slide, please. The risk of infectious diseases. Certain migrants entering Ireland are at elevated risk of infectious diseases. This may be due to an increased incidence of various infectious diseases in their country of origin. They may experience disrupted living conditions before or during their displacement that may increase the risk of disease transmission, such as poor shelter or overcrowding with poor ventilation. There may be severe malnutrition leading to immune deficits. Due to circumstances in their home country, they may have received suboptimal or no vaccinations in their country of origin. And they may be up to date with vaccines in their country of origin, but require additional vaccines to catch up to the Irish schedule. All children resident in Ireland should be caught up to the Irish schedule, and children should be immunised according to the Irish immunisation schedule to protect them from diseases that are common in Ireland and may have serious consequences. Next slide, please. Immunisation records for those coming to Ireland. Are immunisation records available? The National Immunisation Advisory Committee Immunisation Guidelines for Ireland advise that children or adults coming to Ireland with no documented or reliable verbal history of immunisation should be assumed to be unimmunised. This includes those coming from areas of conflict, such as the Ukraine, and it may be assumed that undocumented doses or an unreliable verbal history have not been received, and that the Irish catch-up recommendations for that age should be followed. Next slide, please. So I'll now speak briefly about 3 vaccine preventable diseases of priority and outline some recent WHO data and UK Health Security Agency data regarding these diseases. So firstly, we'll look at measles. The WHO reports that more than 140,000 people worldwide died from measles in 2018, mostly children under the age of 5 years, despite the availability of a safe and effective vaccine. The 10 countries with the highest numbers of measles cases in the WHO European region from January to December of 2022 have been listed here. And as you can see, measles continues to be a threat. From recent data in the WHO European region, the vaccination coverage is less than that is recommended, the 95% for MMR2. And NIAC state that an uptake rate of at least 95% with 2 doses of MMR vaccine at greater than or equal to 12 months of age and given at least 4 weeks apart is required to halt endemic transmission of the virus and thus eliminate measles. And next we'll discuss polio briefly. The Ukraine has been experiencing an outbreak of type 2 circulating vaccine-derived poliovirus since October 2021. The national immunisation coverage with 3 doses of polio vaccine in the Ukraine was 83% in 2020. Next slide, please. And that brings us to diphtheria. So an increase in the cases of toxigenic Corynebacterium diphtheria have been identified among asylum seekers arriving into England in 2022 and 2023. So as of the 12th of February 2023, this came to a cumulative total of 74 cases for 2022 and 2023. Next slide, please. The Irish immunisation schedule based on NIAC advice. In some circumstances, advice in the NIAC guidelines may differ from that in the summary of product characteristics of vaccines. When this occurs, the recommendations in the NIAC guidelines, which are based on current expert advice from NIAC, should be followed. Next slide, please. The Childhood Immunisation Schedule. The Department of Health is guided by National Immunisation Advisory Committee recommendations. The vaccines included in the primary childhood immunisation programme are recommended from 2 months of age and are provided over 5 visits at 2, 4, 6, 12 and 13 months, protecting children when they are most vulnerable to 13 vaccine-preventable infectious diseases. Children and adults presenting late for vaccination from other jurisdictions having commenced a different vaccine schedule should catch up with the Irish immunisation schedule. Next slide, please. For children born on or after the 1st of October 2016, the primary childhood immunisation in Ireland consists of, for those aged 2 months, 3 injections and 1 oral vaccine. That's the 6-in-1, the PCV13 and the MenV, and then the rotavirus as an oral vaccine. At 4 months, the 6-in-1, MenB and rotavirus, so that's 2 injections and an oral vaccine. At 6 months, the 6-in-1, PCV13 and MenC, so that's 3 injections. At 12 months, the MMR and MenB, which is 2 injections. And at 13 months, HIB-MenC and PCV13, which is 2 injections. Next slide, please. The primary immunity at 2 months of age for all. So from the age of 2 months, the following vaccines need 3 doses to achieve primary immunity. So they are tetanus, diphtheria, pertussis, polio, and hepatitis B. Next slide, please. Catch up with the Irish schedule. Children who are incompletely vaccinated should catch up with the Irish schedule as per the immunisation guidelines for Ireland. Vaccines given in the Irish schedule that are not given in countries where some refugees may be from include MenB, which is recommended up to the age of 2 only unless they're in an at-risk group, PCV13, which is recommended up to the age of 2 only unless in an at-risk group, MenC, which is recommended up to first year of secondary school when they will receive MenACWY, and rotavirus vaccines given until 8 months and 0 days only. Next slide, please. This brings us to the 7 principles of catch-up vaccination. The first one is that MenC vaccine given before 12 months provides protection for a child's first year of life only. So when a child reaches the age of 12 months, they need 1 dose of MenC given in the HIB-MenC vaccine only, regardless of whether or not they received MenC vaccine in their first year of life. The second principle is that PCV13 vaccine given before 12 months gives protection for a child's first year of life only. When a child reaches the age of 12 months, they need 1 dose of PCV13 only, regardless of whether or not they have received PCV13 in their first year of life. The third principle is that if the 6-month vaccines are late, for example, if they're given at 9 months, there is no need to delay the 12-month vaccines. The fourth principle, if a child needs to catch up with both 12 and 13-month vaccines, they can be given at 1 visit. The fifth principle, once a child reaches the age of 2, the National Immunisation Advisory Committee advises they no longer need PCV13 vaccine or MenB vaccine, even if they've never had these vaccines. But the exception is children who are at risk and who have at-risk conditions, and they should be vaccinated. The sixth principle is once a child reaches the age of 10, they no longer need Haemophilus influenza type B vaccine or HIB vaccine. And the seventh principle is that a child over the age of 1 year needs a single dose of MenC up until MenACWY is given in school. Next slide, please. There's a printable version of these principles available from www.immunisation.ie called Tips for Catch-up Vaccination in General Practice, and they can be useful to print and have in your workspace for reference. Next slide, please. The minimum intervals and catch-up vaccination. The optimal recommended ages and intervals provide the best immune response. The minimum interval is the shortest time between 2 doses of a vaccine in which an adequate response to the second dose can be expected, and you can refer to Table 2.2 in the NIO guidelines for optimal and minimum intervals. In exceptional circumstances, for example, imminent international travel or a measles outbreak, it may be necessary to provide 1 or more vaccines at less than the optimal age or interval. The accelerated schedule should not be used routinely, and remaining doses should be given at recommended intervals to ensure best protection. Next slide, please. The NIAC catch-up schedule. So the NIAC Chapter 2, this is the catch-up schedule in Irish children up to the age of 4 years, and this is Table 2.3 from NIAC Chapter 2, which is the catch-up schedule for unvaccinated or incompletely vaccinated children aged 4 months to under 4 years. Those more than 1 month or a dose behind the schedule should be on a catch-up schedule, with minimum intervals between doses. So you choose the age-appropriate column, and then if a person is completely unimmunized, vaccinate using the intervals stated here in the table. If the person is incompletely vaccinated, provide vaccines that they have not already received, and there's no need to restart a course. So once catch-up has then been completed, you continue with the routine schedule. Next slide, please. Similarly, this is NIAC Chapter 2, Table 2.4, which is the catch-up schedule for unvaccinated or incompletely vaccinated persons aged 4 years and older. Next slide, please. NIAC catch-up schedule changes in August 2022. So Tdap IPV vaccine is no longer available in Ireland, which prompted NIAC to issue new guidelines for those aged 10 years and over who are unvaccinated or incompletely vaccinated. For children aged 10 to 13 inclusive, they're now recommended to receive DTaP IPV by 3 doses at greater than or equal to 28-day intervals. For children aged 14 to 17 inclusive, they're now recommended to receive Tdap vaccine by 1 dose, followed by TD IPV by 3 doses at greater than or equal to 28-day intervals. For adults aged 18 and over, they are now recommended to receive Tdap vaccine by 1 dose, followed by TD IPV by 3 doses at greater than or equal to 28-day intervals. Next slide, please. And this slide shows NIAC Chapter 2, Table 2.4a, which outlines this catch-up schedule for unvaccinated or incompletely vaccinated aged 10 years and older if Tdap IPV is unavailable. Next slide, please. So now we will discuss catch-up vaccination for different age groups. And these are the vaccines required if an individual has never been vaccinated. So at 12 months of age to under 2 years of age, there's the 6-in-1 by 3 doses given at greater than or equal to 8 weeks apart. Men B by 2 doses given greater than or equal to 8 weeks apart. And the MMR, Men C and PCV13, 1 dose each. Then from 2 years of age up to 10 years of age, they should get the 6-in-1 by 3 doses greater than or equal to 8 weeks apart. And for the MMR, if they are aged between 2 and under 4, they get 1 dose. And then they should receive the second MMR as part of the routine school immunisation from 4 years of age. But that second MMR must be at least 1 month after the first dose. If they're aged between 4 and under 10, then they should get 2 doses of the MMR given greater than or equal to 28 days apart. They should also get Men C by 1 dose. And just a reminder, Men B and PCV13 are not recommended because they're recommended up to the age of 2 only, unless the child is in an at-risk group. And if they miss the 4-in-1 in school, then they can get DTaP IPV at least 6 months and preferably 3 years after the primary course. Next slide, please. From 10 years to 13 years inclusive, they should get DTaP IPV by 3 doses, greater than or equal to 28 days apart, and then TD IPV 5 years after the primary course. They should get MMR by 2 doses, greater than or equal to 28 days apart, and a Men C containing vaccine. And Men ACWY only is what's given in second level schools. Next slide, please. From 14 years up to 18 years, they get Tdap by 1 dose, followed by TD IPV by 3 doses, greater than or equal to 28 days apart. And they should leave a greater than or equal to 28-day gap after Tdap. MMR by 2 doses should be given, greater than or equal to 28 days apart. And a Men C containing vaccine. Men ACWY is given in second level schools. And essentially they should get 1 dose up to the age of 23 years of age if Men C containing vaccine was not given over or at greater than or equal to 10 years of age. Next slide, please. And here are some further resources for healthcare professionals on catch-up vaccinations. We have a dedicated webpage at www.immunisation.ie, which I encourage you all to visit. There's a catch-up vaccination toolkit there, which you can find helpful. We also have frequently asked questions. There's COVID-19 vaccination information, and there's information available in other languages, including Ukrainian. And also clinical queries may be emailed to us at our dedicated inbox at immunisation@ie.ie. hse.ie. Also, there are the NIO guidelines, which are now hosted on the RCPI website, and they contain guidelines on catch-up vaccinations, including all of the catch-up tables that I've shown in this presentation. And finally, I would just like to thank all of the NIO staff for supporting and enabling this Lunch and Learn session today, and thank you all for your attention. Thanks very much.
Vaccines are costly and must be managed carefully. The cold chain, we often hear about cold chain. What actually does that mean? It means that vaccines must be stored within a specific temperature, which is 2 to 8 degrees, to ensure their potency and to comply with regulations. Therefore, strive for 5. So it's 5 degrees plus or minus 3 degrees. Freezing may cause the vial to crack and lead to contamination. So freezing is really a no-no. So for you, continuity of the cold chain until the time of administration is essential. Actions at your site, therefore, should include immediate refrigeration of vaccines, twice daily reading of the fridge temperatures, and record this if you do not have a data logger. Review of data logger, download, and always check the battery of the data logger to make sure it is working. If your vaccine loses potency due to a temperature and you administer that, revaccination will be required, and this may lead to loss of confidence in the programme, which may eventually affect uptake. Next slide, please. So, stock management. Vaccine stocks should be kept to a minimum by regularly ordering the anticipated quantity of vaccine required until the next delivery. And we know that you get deliveries every month. So please just order what you think you will use between deliveries. And therefore, if there's one person involved in that, that person can dedicate their time to calculate their expected usage based on the target cohort size. And check the online calendar for your closing date of order. Put a reminder in your phone and just say, yes, I must do it, and I must place my order before 3 p.m. on that date. Next slide, please. Stock rotation, hugely important. Rotate the stock when checking your pre-ordering, before you place your order, or when you're placing the new delivery into the fridge. Rotate the stock. Rotating stock prevents a build-up of expired stock, and overstocking or not rotating stock may lead to expired vaccines being administered, and therefore this will definitely require revaccination. Again, this could affect the confidence in the programme. Next slide, please. Temperature deviations. You immediately email, we have a new email, pharmacy.nio@hse.ie. That's pharmacy, PHARMACY, NIO@hse.ie. Email immediately, say I have a temperature deviation, and you will be told exactly what to do. But in the meantime, keep your vaccines in quarantine between +2 and +8 degrees. Email pharmacy in the NIO. Follow the advice received. If advised that vaccines have been adversely affected, remove them immediately from the fridge. Place in a box with completed vaccine return form and store securely and conveniently until they are returned to the NCCS fan driver at next delivery. Next slide, please. Remember, please, vaccines are valuable and include them in your insurance policy. Your vaccine delivery requires immediate attention. Read fridge temperature twice daily. Rotate your stock. Do not overstock. Order vaccines on time. And that's my presentation. And thank you very much. And thank you all for attending.
Thank you, Cliona. Hello, everyone, and thank you for joining today's session. My name is Cría Dowling. I'm a Communications Officer in NIO, and today I'm going to be talking about the supporting information materials we have available on catch-up vaccinations. So on behalf of the HSE, the NIO is tasked with developing training communication materials for the public and health and care professionals for our national immunisation programmes. Last year, to support people coming from Ukraine, we developed information for health and care professionals to support catch-up vaccination. And in recent months, we've developed similar guidance for people coming to Ireland from other countries. We also developed a HSE Land training e-learning module to support people coming from other countries. You can visit hseland.ie today to complete the programme, and it'll help vaccinators to understand the vaccines that are needed for catch-up vaccination programmes. We use a patient-centred approach to make sure our resources have been developed with the communities and the terminology and language that we use is accurate. We have materials available in over 10 languages. And we're also working this year to develop materials in more languages. All of our materials are available on our website, www.immunisation.ie, which is WHO accredited website. And keep an eye out on our website and our social media for new materials that we'll be developing later this year. And just one resource in particular that we'd like to highlight today is a video series that we developed last year with Dr. Oksana Kozova, pediatrician from Ukraine, but living and working in Ireland to support people coming from Ireland or coming to Ireland from Ukraine. The videos have been shared widely on social media, WhatsApp and Telegram, and they're all available on our YouTube channel also.